If you're someone that struggles with flexor spasticity in your lower body, then that means that when you try to take a walk, your knees are constantly bent forward like this. Your knees are constantly bent, you're constantly tipped forward, and when you walk, you either probably knee kiss like this, or you knee kiss and then hyperextend, knee kiss and then hyperextend. What this is caused from is an overactivity of the flexors in your lower body, and I have a series of exercises that's going to help you right now. What's up, YouTube MS Gym family? My name is Trevor Wicken, and I am the founder and creator of the MS Gym, the largest platform for movement, mindset, and education for people affected by MS and other neurologic conditions. So we release videos on this channel quite often, so make sure that you watch this video, you like this video, and then you go and subscribe to this channel so you don't miss out on all the awesome content that we're going to be putting out that's going to help you counteract your symptoms and live a life by design and not by diagnosis. With that, I encourage you to watch till the very end of this video because I always have some special offer for you that will give you an opportunity to come train with us inside the MS Gym. So when we talk about flexor spasticity, that means that we have too much activity in the flexors around our knee or in the upper leg, in the hamstrings, and we have weakness in the quadriceps or the knee extensors that are typically going to help counteract or combat that flexor spasticity. Take a look at this diagram here. So the strategy to counteract leg flexor spasticity or knee flexor spasticity is going to be to reduce the hypertonic or the overactivity in the hamstrings and to increase the strength or the activity in the quadriceps or the knee extensors to override or counteract that spastic flexor pattern. So the first thing that we're going to do here is we're going to release the muscles in the hamstring, okay? So we're going to take our hands and we're going to wrap them around our leg, and we're just going to try to start working on the outside, the outer portion of that hamstring. So my quadricep line is going to be right here. It is below that. So we want to dig our hands into those muscles in those hamstrings, or we can use a foam or a rolling pin and roll up and down on those hamstrings too. If it's really tiring for you to use your fingers to release those hamstrings, then use this roller. What we're going to do is we're either going to use our hands to try to find some trigger points or some spastic points, and then we're going to massage those for 30 to 45 seconds, or we're going to use the rolling pin to go up and down for anywhere from 30 to 45 seconds as well on the outside of that hamstring. Okay. Now, once we're done with the outside of the hamstring, we're going to go to the medial side of the hamstring. So again, we're going to wrap our hand around, get on the back side back here. Okay. Not the adductors, but just below that. And we're going to try to dig in and see if we can find some spots in the medial hamstring that's really causing that knee flexion spasticity. So I have some spots right there. You can also use the rolling pin on this side. Okay, relaxing that leg and just rolling back and forth. So again, 30 to 45 to 60 seconds rolling out those medial hamstrings is going to upregulate that parasympathetic nervous system and help to calm down that protective spastic pattern that's in the hamstring. So once we've released those muscles, okay, we want to stretch them. So all we're going to do here is a straight leg hamstring stretch. So you're going to put that leg out in front of you, not into a hyperextension, but just into a soft knee extension, okay? A soft knee extension, not a hard knee extension. So we're going to push down into a soft knee extension, okay? If you need to hold under your leg, that's fine. And then all you're going to do is just lean forward and do a 5 count. 1, 2, 3, 4, 5. Come back and chill, okay? Because we want to give the brain a stimulus to allow that stretch to happen in the hamstrings, but not keep it under tension so long that the brain freaks out, okay? And again, go ahead and lean forward. 1, 2, 3, 4, 5, feeling the stretch in the hamstring, and sit up, okay? And one more, and go. 1, 2, 3, 4, 5, and come back up. Now, after 3 of those 5-second dynamic stretches, we're going to go into a static stretch for 15 seconds, okay? Ready? And lean forward. And it's a 1, 2, 3, 4, 5, 6, 7, 8, 9. Lean a little forward if you need to. 10, 11, 12, 13, 14, and 15, and relax. So again, 3 to 4 of those 5-second short hold stretches to allow the brain time to accommodate the elasticity demand in those muscles. And then on the last one, we go into a 15 to 30 second static stretch hold, which is once the brain's used to being in that stretch position so that it settles into the stretch more and starts to learn how to become more stretchable and more elastic. Now finally, after we've released the hamstring, after we've stretched the hamstring or the knee flexors, now we're going to use the opposite muscle group, the knee extensors, to counteract or override the hypertonicity in the hamstring. We're going to do that by doing an isometric leg extension. So what you're going to do is sit up nice and tall, abs are in. If you need to put your hand under your leg, that's fine, okay? And what we're going to do here is we're just going to lift this leg up. We're going to hold it for 5 seconds. And then we're going to put it back down. All right, here we go. So sitting up tall, abs are in. Make sure your body's nice and braced. We're going to go ahead and lift this leg up. Now, it doesn't have to lift very high. Even if you can just get your leg up that much, it's still going to be effective, okay? All right, here we go. Ready? And go ahead and lift up as high as you can. And it's a 1, 2, 3, 4, and 5. Bring it back down, okay? And up. It's a 1, 2, and I want you to try to squeeze this muscle here, this thigh. 4 and 5, back down. And up, 1, 2, squeeze the thigh. 3, 4, 5, back down. And up, 1, 2, 3, 4, 5, back down. Last one, and up. 1, 2, 3, 4, and 5, back down, okay? So typically I recommend doing between about 5 and 10 repetitions, 5-second holds, okay? Because leg extensions can be really hard, especially if your body's been compensating using that flexion spastic pattern for a long time, okay? So again, we're gonna release those muscles to upregulate our rest and recover mode. We're gonna stretch those muscles to allow our brain to start learning how to be not spastic, and then we're going to activate the opposite muscle group, the extensors, that are going to counteract the flexors and add more dynamic muscle, nerve, and joint balance around the knee, through the hip, and throughout the lower legs so that you can stand better, balance better, and hopefully walk better.